good. How are you? How are the girls?
Oh, they're excellent.
Sine was born really premature, and she was a twin. She was about 4 months early. She was in the neonatal intensive care unit at another institution to stabilize her for about the first 7 to 8 months of her life.
Unfortunately, because of Sine's long prematurity, she wasn't able to wean off the ventilator. I think they tried maybe 4 to 6 times to wean her off, and on the 6th attempt she coded 2 times in one night, and it was at that time that they decided to give her a trach. She was there until they were able to stabilize her.
I'm really thrilled to hear how she's talking.
And when she came to us at Rabida, she was on a ventilator and dependent on it. She was very small. If you walked in a room or touched her or spoke to her, she would startle and her heart rate would go up, and she needed a lot of care. She made good progress in the hospital, but when she went home, she was, of course, still on the ventilator, still requiring tube feeding, and requiring a lot of support at home.
Once a child is discharged from the hospital, we follow them closely in our clinic, and we want to make sure that they're meeting their developmental milestones and make sure they're gaining weight appropriately. If we keep doing the formula or the recipe that you're using, they're never going to hit this area where they'll be like good, strong, healthy kids. Do you know what I mean?
I understand.
Okay. Another benefit of the medical home clinic is that we have multiple disciplines that can help the child. In a typical clinic, you may have just a pediatrician and a nurse, but the benefit of the medical home clinic is our multidisciplinary approach. We have a case manager, we have a social worker, a family advocate, a nutritionist, a dietitian, and a development specialist. So we have a lot of pairs of eyes on the patient to identify any issues that may arise, to identify any problems, and to help solve them quickly to maximize the development and growth of the child.
Hello! Hey guys, how are you? The way we've designed medical home is to do whole care and also to take families who have complicated kids and not have them going from place to place to place to place to see different people, but to have all their needs of their child taken care of. Everybody goes in and sees the family, and then afterwards we can sit down and say, okay, this is what happened this morning, and what did we think the child needs? What supports did the family need? What are we going to do this next week to ensure that all those things start to happen, and how do we put everything in motion? And being a team allows each of us to use our own expertise, to rely on other people's expertise, to make sure that nothing falls through the cracks, and that the whole care and the whole family is attended to. Because with pediatrics, taking care of the child alone isn't going to be enough. You really have a whole family around them. You have a parent, you have a caregiver, you may have siblings that are affected by what's going on with that child, and you really need to figure out how to support all of that.
Let's check the ear, baby girl, huh? Yeah. Atta girl.
Coordination of care for children with special health care needs is so important. To be able to have one place where the family knows that there's a team that understands what their child needs, and services are not fragmented. The parent knows that there's one person to call, understands their child, knows who their child is, and can really help with them whenever something comes up. As well as coordinate outside of Rabida. So there's many systems in addition to what we work here. There's the educational systems, early intervention, the school system, the government agencies. It's working with the community agencies that help support the family and all that they need to be able to have the best quality of life for them and for their child.
We have an excellent teaching program here at Rabida, and we have to prepare them for every aspect of home care. So helping them manage transportation, getting their medications, their follow-up appointments. So in essence, nurse case managers are preparing families to be their own case managers in the home.
When you're home, it's just you, and all of the responsibility for caring for this child falls upon your shoulders. And I remember that there was so much in our training that while you may get frustrated, while you may think, oh, they'll be fine once they're stabilized and they make it home, there's so many occurrences where you can lose this child. And we had quite a few, and I thank God that we had the training that we had.
The medical home is this set of arms that originate at La Rabida that sort of wrap around the family, around all of her services that she gets in the hospital, in the outpatient setting, and also for the therapists in the home and the school. So the families are her primary teachers, and the medical home as a system supports them so that they can help Sine fulfill her potential.
We let them know what this program is about, how the ASQ works in the state of Illinois, and CFC, early intervention.
So La Rabida is very proud that we have NCQA recognition, National Committee on Quality Assurance. There's very specific standards, there's very specific types of quality measures that we have to be able to provide to be considered a medical home, because the whole point of NCQA is to be able to enhance our quality of services to our families.
I have to hold everybody, did you know that? Every baby. If I don't hold every baby, I might lose my job. Did you know that?
The medical home in and of itself and the team approach is above and beyond what most people would get in a primary care environment. These are families that initially needed an awful lot of support. Were seen in the hospital, not like typical children, 2 months and then 6 months and then once a year, but really seen for a very long time, every 2 to 3 months. And now are coming in 2 to 3 times a year just to check in, seeing their specialists, and done very well. And their families are good advocates and know when to call. I'm having problems with this, can you help me out? But not needing the extreme support that they needed when their kids were younger.
Bye. Little boy blue, come blow your horn, toot toot, toot toot. Little boy blue, come blow your horn. Sheep's in the meadow and the cows in the corn. Toot 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 toot. Toot 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 toot. Can you toot toot? I bet you can toot toot. Yes, I got a half a smile. I got a half a smile. Yes, I got a half a smile.